my name is Jade. I'm going to be your nurse today, and I have doctor's orders to insert an NG tube on you. So I'm first just going to pull the curtain, and I'm going to wash my hands. My hands have been washed. Can you please say your first, last name, and date of birth for me?
Stephanie Campbell, 8658.
Okay. Have you ever had an NG tube put in before?
No.
Okay. An NG tube is basically to decompress your stomach, and so what it's trying to do is get all the fluids and the contents out of your stomach so that you can start feeling better. So have you ever had any history of nasal polyps, a deviated septum, any nasal surgery, any trauma to your nose before?
No.
Okay, and are you on any anticoagulants or anything like heparin or anything? Okay. So I'm just going to first put your bed to my waist, and I'm going to put you in a high Fowler's position so that you don't try not to have you choke or anything like that, and to just facilitate the passage of the tube. So I'm just going to put you in the high Fowler position, put you to my waist, and then put a side rail down. Okay, so what I'm going to be doing with the NG tube is I'm going to basically take a tube, and it's going to go in your nose, and it's going to go down your throat all the way into your stomach. And so this is an uncomfortable procedure because I do have to go down your throat. And so you may feel nauseous, you may feel like you have to throw up. And so here's a basin in case you do need to throw up. And this is, like I said, it's an uncomfortable procedure. You may have discomfort, but if you start feeling like you can't breathe, you can't speak, it's just too painful, or if I see that you're bleeding, you're in respiratory distress, or if I feel any resistance, I'm just going to pull it out. So you just raise your hand. You raise your hand if you want me to stop, or if it's too much, and I'll pull it out. So that's what we're going to be doing, but I'm first just going to check your gag reflex. So if I had a tongue blade, I would be touching the back of your uvula to see that gag reflex and to make sure it's intact. So in reality, I would put gloves on and check, okay, your gag reflex is intact. But now I'm going to observe your nasal passage, so I'm just going to put on gloves. Okay, so I'm just going to look in here. Okay, I don't see any blockages. The skin looks good. So if you could just take one finger and put it on one nostril, and then just breathe in and out. Okay, and then do it with the other one. Okay, I'm looking. Everything is clear. Sounds clear. So I'm just going to pick, for the purposes of this, I'm just going to do the right nasal, the right nostril, the right nair. And okay, so we've checked the gag reflex, we've checked the nair. So I'm just going to set up everything that I need set up, and then come back. I have everything set up that I need. Okay, so now what we're going to be doing is I'm going to put this on you. This is going to be our towel, so if you have anything comes up. But in reality, you would be in a high Fowler position. You'd be higher than this, but for the purposes of the video, we're just going to do it like this. And what's really important is you have water right here. And so this is going to be important because this is kind of a good analogy, is we want the water's going to your stomach, so we want the tube to go that way as well. So we want the tube to kind of follow the water. So that's why I'm going to make sure you're drinking water so that it doesn't go into your lungs, so that the tube doesn't go into your lungs, but that the epiglottis is closed, and that it's going down, so it's not going into the lungs, like I said, and it's going down into the stomach. So I'm going to have you be taking sips periodically throughout the insertion, so just please listen to me when I tell you. It's going to make it a lot more smoother. And so I'm just going to put this here for 1 moment. Okay. Alright, so we're going to measure it. So this has already been open from practice, but I would be opening this, and then we're going to first be checking the length. Okay. So what we're going to check is we're going to check from the tip of the nose. Oops. I'm going to be checking from the tip of the nose to the earlobe. Okay, so tip of the nose to the earlobe. And then from the xiphoid process, we're just going to kind of guesstimate here, and then to the earlobe as well. So once we have that measurement, we're going to tape it off. I'm just going to put a piece of tape so that we know the measurement of when we need to stop going any further. Okay. And this would also be an important time if we did have any like topical anesthetic that I would administer if the doctor had ordered anything. I know in the hospital they like broke this apart and there was an anesthetic already in there, but just for the purposes of this video and what I've learned from ATI, we're just going to work with this. And so what we need to do before we do that is we would take the lubricant and put it on here, and I'm not going to actually do it, but we would do 4 inches and make sure that it's lubricated. And yes, so we're just going to come over here. And so like I said, you may feel like you need to vomit or feel nauseous, so you have the bin here in case. But if you could just take deep breaths for me while I put it in. So you're going to kind of like hyperextend your neck. And then when I tell you, you're going to put your chin to your chest and you're going to start drinking that water, okay? So let's just have you hold that, get that ready. And in reality, it would be more upward, but so if I did this one, so we'd have it go in, it's going in your nose. And so go in, go in, go in, and then put your chin down and then start drinking the water. Okay, so then you would be drinking the water, drink, drink, sip, sip. Sip, 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 sip. Okay. Sip, 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 sip. Okay. So then once it's in there, I would stop. I know when to stop when the tape, when the tape has reached to this point of her nose. And so I'm actually I would take also, I would take a permanent marker and just mark that in case if it repositions, just so I know where I had placed it or if I need to push it in more or whatever. So I would just make sure that I mark it on there, and then I need to secure it. So I would need to secure it to her nose with tape or with something, and to just make sure that it's not so close to the mucosa that it's irritating her. And yeah, so we want to be careful of that. Make sure it's secured, and then we also want to make sure that this lumen vent is above her stomach and clipped onto her gown. So that's also something we need to be aware of. And the most accurate way to assess whether the tube is in the right place, if it is in the stomach, is to check the x-ray. That would be the gold standard. That's what we want to do. But another way to check to see if we have an idea that it is in there is checking the aspirate. Well, actually, once the tube is actually in there, the first thing we want to do is take our pen light and have her open her mouth. And then we want to make sure that tube, you can see the tube back there going down. So that's really important. That's the first thing you want to do once you see that. But then we also want to make sure that we have an approximation that it is in the stomach. We are going to take our 30 milliliter syringe. This should be 30 milliliters. And we're going to aspirate some of the contents. And then I'm going to put it in this little container. And then we would put a pH strip, and the pH should be from 1 to 5, and that would give us that would tell us that it is the stomach pH, and we are in the stomach. So that's a really good indicator. We definitely want to do that, but the gold standard of checking is the chest x-ray, if we can get one and can do that. So all right, so it's all in there, and you want to make sure the patient is okay, that they obviously can breathe. And yes, another thing is we also want to make sure that, so the tube would of course be in there, but we want to just check for lung sounds as well to make sure it didn't go into the lungs and we can't hear anything abnormal. She has clear lung sounds. So we would be, I'm just going to do it a little faster for the video. So we would be checking it, of course, and making sure the lungs are okay, because ABCs. You also want to be making sure that the patient was mouth breathing throughout the procedure, because obviously it is going into the nose. So we just want to make sure mouth breathing would help with that. And then you also want to make sure that you've kept it clamped, the tubed clamp, until we figure out that it is definitely in the stomach. Because we don't want to start anything until we know it is in the stomach. Like I said, the best way is with the identification of the chest x-ray. So once we've done B crowd, I've left her and I've come back, and it's time for removal. So you also want to educate your patient that removing it is going to be uncomfortable as well. You may have nausea and may have gagging. So the same goes. If it's too much, just raise your hand and let me know. I would do this again, give her the basin. And the water we're not going to use as much unless she needs it, but we're just going to have her hold her breath as I pull it out. And this is also time if I would need to irrigate it or anything like that, if the doctor had ordered that before we take it out. And also if there was feeding or if there was feedings going on or suction, I would make sure I want to discontinue that and flush the tubing and clamp it and discontinue all of that. And of course we want to make sure that we remove the tape from the nose and unclip it from her gown so that we can safely pull it out without it tugging. Yeah, so once it's in there, so we're just going to pretend again like it was all the way in her stomach. If you want to hold that. Okay. So if it was all the way in her stomach, and then I would ask her, okay, just Mrs. Campbell, if you could just please take a deep breath and hold it, and then I'm going to make sure I pinch the top of it and that I start pulling it out. And pulling it out as quickly as possible as she's holding her breath, so then it's out. And the first thing you want to do is make sure you check the tip of the catheter, because we want to make sure it didn't break off and it's not in her stomach. So that's really important that we do that. And you want to pull it out quickly and make sure you discard of all these contents, put the tubing back where it's supposed to be, and of course throw all of this away. And we also just want to make sure that the patient's okay, see how they tolerated this procedure. And this is also time that we need to check oral care throughout the whole time of having an NG tube. Oral care is really important. You want to be brushing their teeth and making sure that, of course, you are taking care of the oral care. So this is also time you would do that, and you would check the nares, make sure the nares aren't irritated. And so you need to make sure that you're doing that. And yes, so this is very important, and making sure the patient's okay. And all right, so then I would remove my gloves, and of course I would wash my hands, and then I'm going to be lowering her bed again, putting the side rails up, only 2, and then making sure I give her the call bell and say, call me if you need anything, press the button. And then I'm washing my hands, of course, again, and documenting, making sure I cleaned up and documenting the procedure, how the patient tolerated. Of course, once we insert it, we should be documenting all of those things. And also when we remove it, documenting the patient's response and how she tolerated it and all of that. And also making sure during the insertion that we have documented the type of pump, the saline sump, the dual lumen stomach tube, the 14 French, what it was, if you aspirated, how much you aspirated, the pH acidity, the condition of the nose, the nose and the oral care and all of that. And just making sure you document. And okay, how did you do? Are you feeling okay? Any questions?
Yes, I'm feeling fine.
Okay, so wash your hands, like I said, and we document. Thank you.